Basically, you're trading one set of problems for another. So the device in itself can cause bleeding, can cause risk of stroke. There's a plethora of complications involved with it, but at the benefit of them living longer and having improved quality of life. So I tell patients, if we don't do this, the next year you'll likely pass, and during that time you're going to have a poor quality of life. You're going to get increasing shortness of breath. You're going to feel suffocated. You're going to really be a significant burden in terms of how you're going to feel, and your shortness of breath. Patients state that they feel like they're drowning, and which is a terrible feeling for these patients. So I tell them that's going to get improved, and instead of passing within the next year, patients live several years. I tell patients the average life expectancy on an LVAD called destination therapy, called DT, destination therapy. Those are patients that can't get a heart transplant. Those average times are 3 to 5 years that they're living with this mechanical heart pump and doing well, living with family. And then patients that are candidates for heart transplant is basically what we call bridge to transplant. And those patients are going through a season where they need to be on this mechanical pump until they're well enough to get a heart transplant. So those are two different populations, but truly the ones that are destination therapy are ones that are not candidates for heart transplant for certain reasons. And those patients still live a very great life, living 3 to 5 years on this mechanical heart pump. We want them to thrive locally. That's our goal. We want them back to their independence, able to go back to work. A lot of patients go back to work. They're able to drive. Just because they have an LVAD does not limit them. So we make sure that's important as well.